Data from the National Institute of Health is showing a concerning rise in the number of breast cancer cases among Asian American and Pacific Islander women. From the year 2000 to 2021, AAPI women under 50 years old saw a 52% rise in cases. By comparison, the overall rise in diagnoses across all races and ethnicities in that same time frame was just 3%. And medical experts have yet to figure out why. Dr. Helen Chew joins me now. She is a professor of medicine at UC Davis Health, and she is the director of the Clinical Breast Cancer Program. Dr. Chew, thank you for being here. I was astounded when I heard these statistics. What are some of the possible reasons that we might be seeing this rise?
Yeah, those statistics are certainly very concerning. I think one thing that we have to take into account when we look at the data is that the large group of Asian Americans and Pacific Islanders encompasses a huge group of very diverse subjects. In other words, people that come from all of Asia, the Indian subcontinent, and including the Pacific Islands and Micronesia. So we're talking about a very diverse group of people. And within that group, there are just different educational attainment and socioeconomic status, which can influence one's access to health, one's uptake of health, including screening. We also know that that group is the largest group that's populating the United States, and mostly that's by immigration. And so, therefore, we have a lot of peoples coming from different areas that have different exposure, different levels of acculturation, different ways that they view their health care.
And you make a good point about how diverse the AAPI umbrella is, because we know that when you look even further into the data, that Hawaiian, Native, and Pacific Islanders, that the rates of diagnoses of cancer is beyond 50%, is more than 100%
Yes.
over this same time period. And it's not just diagnosis. When we're talking about the national death rate for breast cancer, that, in great news, has been steadily declining over the past decade, but that's not the case among AAPI women. It has stayed basically unchanged. Why might that be? Is it the same factors, and what different interventions need to be done then?
Yes, I think it's not quite clear. Again, great questions. I think part of the challenge we have is that we don't have all the data separated into all the different groups. So, in other words, there's very different outcomes between Asian Indians versus Laotian or Hmong versus people, as you say, from the Pacific Islands. So we have to know that we're interpreting the data as a lump and not among the different groups. But you're absolutely right; it is very concerning. We're also seeing an increase in death rates, not only in breast cancer but also uterine and cervix cancer. And so I think these are things that really need to be studied further, and that we encourage all further studies to really take into account that this is a very diverse group, and we'll learn more as we divide these groups, up appropriately.
And is are the funding dollars there? AAPI, the community is smaller than some other demographic groups, and sometimes that means that there just isn't the same amount of dollars. Do you think that we have what we need in order to get some answers to these unanswered questions?
Right, I think you've really nailed it. I think there isn't enough funding to look at this very large, diverse group because it is an enlarging group of Americans here. The group is just rising. We really do need more research so that we can answer these questions better. As far as what women can do, I would say screening. We know that a lot of groups among Asian Americans in general, the larger group, the uptake of screening is lower than among whites, and so I think that's an immediate thing that women can do in terms of paying attention to what is recommended in terms of screening.